Hello and welcome to my cozy Q&A where I will be answering the questions that you submitted to me. I got my nice cup of tea. It has little cats on it. If you don't know, I am obsessed with cats. I don't know if this is going to zoom in, but anyway, there's cats. People submitted some questions on Instagram, so thank you for that. If you want to get in on some future Q&As, feel free to follow me on Instagram at A-Physio, where I'll post my stories and then you can get some of your questions answered. So we'll dive right into it. Most of the questions were chronic pain related or physiotherapy related. I have them here on my phone. I'll try and put them on the video as well. The first question was pain reprocessing therapy. How does it help pain? Tell me more. I have some stuff written here from the Pain Reprocessing Therapy website. So it's a system of psychological techniques that retrains the brain to accurately interpret and respond to signals from the body, breaking the cycle of chronic pain. So with PRT or pain reprocessing therapy, there's a couple different components. The first part is really getting education around your pain and understanding that it's a nervous system response. It's not about tissue damage in this case of pain. And then there's something called somatic tracking, which is kind of like meditation, visualization exercises that help to retrain the brain to no longer sense pain signals as dangerous. And that's kind of the primary way that it works. If we're looking at research here, there was a randomized controlled trial that showed 90% patient improvement and 66% becoming completely pain-free or nearly pain-free at the end of pain reprocessing treatment. So this was also largely maintained 1 year later. And I'll link the study below. If you're interested, you can take a peek at that. This is something I offer. If you live in British Columbia, you can book in with me on my website. If not, my course, Change Your Chronic Pain, involves some things on pain reprocessing therapy. So you can get that and learn a little bit more about this and use some of the somatic tracking tools to help your pain. Next question. Let's see. This one is, can you chat about your migraines? What you do for them? So yes, my migraines, I have had migraines, I want to say for about 15 years or so. I could have had them younger and I just didn't realize that they were migraines, but around the age of 20 or so, I started getting migraines. And what I do for them personally, so I do use pain reprocessing therapy, what we just talked about. I use the somatic tracking on my migraines. I find it very helpful to help retrain some of the thoughts around the migraines and some of that hypervigilance and being really scared when they do come on. I have trialed a couple different medications, both of which didn't really do much for the migraines. And then I also get Botox every 3 to 4 months, depending. And that is really helpful for me as well. So I went from having roughly 15-ish migraines a month to I probably get 3 or 4 a month now. So with pain reprocessing therapy with Botox, I do use exercise as well. There is some evidence on zone 2 cardio for migraines, and I will link the Instagram reel from Life of Migraine where she talks about this, so that can be helpful too. Those are the things I find helpful for me. Everyone is going to be different, so it's always best to talk to your own healthcare provider to find out a plan that'll work for you. Let's have a sip. I'm drinking Bengal Spice in here, if anyone knows about Bengal Spice tea. I would love for you to share your favorite teas below so that I can try some new ones. Okay, this next one was, what's your skincare routine, with a heart eye emoji? So maybe this person thinks I have nice skin. Thank you. I am not wearing makeup right now besides mascara. So this is my normal skin. This is obviously not a physio or pain related question. I don't know much about skincare, so I'm not an expert at all. You can obviously see I have some redness. I do have 2 zits that happened last month and this month that haven't quite healed yet. But I will go through my skincare routine with you. It's pretty minimal. So I wash my face with, currently, CeraVe. I'm going to try and get this. I'm going to drop the mic for a second to see if this will actually zoom. Yeah, I wash my face with the CeraVe Hydrating Cream to Foam Cleanser. This one's for normal to dry skin. I have quite dry skin. So I use this in the morning in the shower, and then I use it at night when I wash up all my makeup. I know you're not supposed to wash your face in the shower because it's really hot water, but whatever. I do that. And then in the morning, I follow that up with, I get most of my skincare from Dr. DiMorelli's skincare line because it's Canadian mostly, and I really try and support Canadian businesses. And all their stuff is cruelty free. It's not tested on animals, which I really appreciate. So in the morning, I will use a vitamin C serum for my face and eye from Dr. DiMorelli. After that, I have this even tone facial serum that my lady who does Botox for my migraines told me about because I noticed there was a darker spot on my forehead. So she said, oh, try this. And it has actually helped quite a bit. I will probably not buy this again just because it's expensive, but I will use it until it runs out. And then I use a moisturizer after that. Same Dr. DiMorelli's moisturizer. And that one is once again for dry skin, since I have dry skin. So I'll use that in the morning, followed by lastly some SPF sunscreen because that's super important. I'm not super picky around the sunscreen I use. This is the one I currently have, Neutrogena 60 SPF. So that's my daytime. CeraVe, followed by vitamin C, toner, moisturizer, and sunscreen. And then if we're going to my evening routine, once again, I will use the CeraVe to wash off my makeup. And then once again, Dr. DiMorelli, I use their retinol. So I'll use a bit of that on my face. And then lastly, currently just have a big old Cetaphil and just put that on my face before I go to bed as well. Once again, for dry to normal skin. So that's my skincare routine. Nothing too crazy. We got 2 more questions. The next one being your favorite physio treatment. So honestly, super probably lame for people, but exercise is my favorite treatment to do with people, mostly because everyone has access to exercise regardless of what it is. You could go for walks, you can do yoga, you can go to the gym, you can do some strength training at home. There's such a variety of exercise that people can do in a variety of ways that we can use it to help people. So I just love that it's so versatile. When we're looking at chronic pain, the research shows us that there isn't one specific kind of exercise that's helpful. So it gives a lot of freedom to just do what people enjoy doing. And it's accessible. So that's my favorite modality. I would say after that, I probably use dry needling or intramuscular stimulation next. Once again, because I think with the people I use it, at least they find it helpful. I think for manual therapy, there's a time and a place for it. I think that there's a lot better treatments. The research around IMS or dry needling isn't super robust. It doesn't show amazing outcomes from it, although it shows some good outcomes from it. So those are probably my top 2 that I use. And then of course, education as well around pain. And then the last question, which I kind of just answered, is what's your go-to exercise to help chronic pain? So unfortunately, I don't have a go-to exercise because everybody is different. Everyone's pain is different. Everybody's tolerance to exercise is different. So I'm usually getting some information from the client or the patient I'm working with to see what they like, what they enjoy, what they've tried in the past, what they haven't liked, and then making a plan based on all of that, choosing what's going to work for them and adjusting as we need. So unfortunately, I don't have a best one. Anyone who tells you there's one best exercise for something, definitely give them a little bit of a side eye because there's usually a wide variety of things that can be helpful. So those are the questions for today's Q&A. I hope that you enjoyed hearing a little bit more from me. And if you want to see more of these, let me know in the comments below. And of course, please tell me your favorite teas so I can get more. Have a great day and stay empowered.